Welcome back. Robin said we were starting timely, and we're going to start timely at 11 o'clock. So to honor all of you who paid attention, thank you. So my name is Michelle Strobe. I am the director of the Segner Center's Environmental Dispute Resolution Program. And since they asked me to do this and be up here behind the microphone, I will now introduce our new activity that's going to be launching tomorrow. It's an EDR, an Environmental Dispute Resolution blog. And there's a little piece of paper like this up there on the upper table that gives you the URL and everything. Please go, please read it, please write for it. Okay, with that, let me introduce our next speaker, who is Chris Spence, director of the Institute at the Golden Gate. And he's going to talk to us about new audiences and new programs, health, education, and nutrition.
Thank you. Well, good morning, everyone. My name's Chris Spence. I'm really excited to be here today to be talking about new audiences and new programs in our national parks. And I'd like to thank Bob and the folks at the Wallace Stegner Center for putting on such a timely and important event, and also for convening such an impressive group of speakers and such an impressive group of participants as well. So this is me. And during the past couple of days, I've spoken with many of you. I've listened carefully to all of the presentations. And one of the things that's really struck me is the passion that all of you here feel for our national parks. You feel a real passion for the history of our parks, and you feel a real passion and perhaps some concerns about the future of our parks. You're concerned about the challenges we face today. You're wondering what the future of the parks looks like and where this path might lead us. So our previous speaker, Audrey Peterman, spoke very eloquently about why our parks should speak to all Americans, no matter what their race, their age, their ethnicity, their background. I actually just finished reading Audrey's wonderful book, Legacy on the Land, which was a fantastic read. It's a wonderful story, and as a former journalist, I really appreciate good writing and good storytelling. But it's also a passionate call to action on diversity. It's a passionate call to action on who we need to reach out to and why we should be reaching those people. So having heard from Audrey about the who and the why, I want to spend a little bit of time talking about the how. And by that I mean, how can we help make parks relevant and of value to all Americans, not just some? And what are some of the specific steps we can take to help ensure that parks continue to be of service to all Americans during a period of rapid social, technological, economic, environmental, and cultural change, and demographic change? And finally, how can all of us here play our part? So I'll give you a brief explanation of where I'm coming from on this. So some of you may have noticed from my accent that I'm not from around here. I'm not from Utah. I'm from Wyoming, actually. Okay, I'm just kidding. So I'm actually from England originally, but for the past few years, I've been based out of the San Francisco Bay Area. And I've been working at an organization called the Institute at the Golden Gate. We're a department of the Golden Gate National Parks Conservancy, which some of you may have heard of. And we're the newest department. We're just 5 years old. And our mission is to help make parks and open spaces and public lands part of the solution to some of the major challenges that we're facing today, such as climate change, such as preventive health care, and challenges in our education system. And we have a kind of way of doing this. We have a theory of change, we call it, which is we try to pilot test great ideas locally, often in collaboration with our friends at the Golden Gate National Recreation Area, Golden Gate National Parks. We then start to identify best practice. We start to build roadmaps for how we might take these ideas to scale and replicate them. And then we influence policy, or try to influence policy and practice nationally, and increasingly internationally as well. And so I'll give you a quick example. We worked very closely with the Park Service and with Director Jarvis over the past few years on the new food standards that were announced last year, and that are now affecting 24 million meals served in national parks. And I'll talk a little bit more about that later. But our work is basically about helping parks go beyond their traditional and important role as places to recreate and to support parks as they take on new functions that will make them relevant to all Americans. And today I'm going to talk about 3 areas where we're making parks relevant and of value: health, education, and food. And in talking about these 3 areas, I'm going to make 3 key arguments, 3 key points. The first is that we need to adapt to survive. So we know that parks are loved. The surveys tell us that, the polls tell us that, even the government shutdown told us that. But we cannot take this love for granted. Society is changing so rapidly that if we want to transform future generations into passionate stewards for our parks, we need to be constantly adapting, constantly iterating in order to make parks relevant and useful to them. Secondly, we need to meet people where we're at. We need to meet the need. And what I mean by that is we need an increased focus on programming and on services that people want or need. It means a stronger focus on outreach and the warm welcome that one or 2 other speakers have mentioned. It probably also implies an increased focus on our urban parks, meeting people where they're at. And finally, we need to be less proprietary and more partnership driven. And Destry and other speakers have spoken very eloquently about this. An advisor, I was in a meeting recently with an advisor to California Governor Brown, and this advisor said to me, you have to collaborate to compete, which it was a line that just really struck me and feels more relevant today than ever in this time of fiscal austerity. This includes partnering across park agencies. It means the national parks working with local parks, with state parks. And I would just add here that in my experience, the public often doesn't know and maybe doesn't care whether it's a national park or a state park or a city park. They do care if it's a good park. They care if it's a park that gives them what they're looking for and gives them a wonderful experience. It probably also means, in terms of partnerships, finding new or unexpected partners that maybe take us into new sectors. So say, for example, we have a new or innovative policy idea for parks. I think it's important for us to move beyond our sectors to reach out to other groups like the museum world or the world of education or another agency, maybe even an agency in another country, to ensure that we're not reinventing the wheel, that we're getting a cross-fertilization of ideas for our parks. So as I say, I think the future for our parks lies in making them relevant to all Americans. And I'm just going to give you 3 examples of how at the Institute we're working with others in partnership to test this approach, to test this idea. So, what has this got to do with parks, you're probably asking? Well, the research suggests that 20 to 30 minutes of this has a similar effect on children's concentration to some leading ADHD medications. At the Institute, we've been working on the role of parks in people's mental and physical health since 2009. And in early 2011, we hosted the first National U.S. Healthy Parks, Healthy People conference out in the Bay Area. You may recognize these people. Thank you for attending. It was a really important event, and I think it helped launch and really push the Healthy Parks, Healthy People, HPHP concept in the US, really move it forward. It was, just to give credit where it's due, it was originally an Australian idea coming out of Parks Victoria. The Park Service has really, to its credit, has warmly embraced this idea, as have some state parks and some local parks as well around the country. And we're thrilled that the National Park Service will be working with the US Centers for Disease Control and Prevention, CDC, and hosting the second ever global HPHP conference in Atlanta in July of 2015. So the Healthy Parks, Healthy People movement is now quite well known in park circles, and I'm sure many of you have probably encountered it or come across it in the last few years. It's a great idea in theory, but the challenge, as usual, is implementation. So how do you turn a really nice, elegant idea like this into something like this? Real implementation on the ground in our parks? And are there some best practices that can be taken to scale? So at the Institute, we spent the past 3 years focused on the challenge of implementation, and we currently have 3 active projects on this. One is at the local level, another at the regional, and the third is at the national level. So first, with support and in collaboration with the Park Service, we've been taking a lead role on a specific kind of subsection, a specific part of the wider HPHP movement, and it's called Park Prescriptions or Park RX, and it's pretty much exactly what it sounds like. It's the idea that doctors are prescribing nature just in the same way that they might prescribe a pill. Again, great idea, great theory, hard in practice. But we've been working pretty hard on this for the past couple of years, and in early 2012, with funding and support from Kaiser Permanente, we launched a pilot project in the Bayview Hunters Point. That's a large, underserved community neighborhood in southeast San Francisco. And we actually spent a year working on this before we launched anything publicly. We spent a year researching the idea, identifying best practice where it existed, because this is a pretty new concept. We spent a year listening to and connecting with the community. We hired a community organizer, a local community organizer. We learned the community's needs and requirements. We also built a very strong relationship with the Southeast Health Center. That's the free city-funded health clinic that serves the Bayview Hunters Point community. We did a bunch of other things as well. We mapped the local parks, the ones that are closest and easiest for those people to reach. We ran detailed training sessions for all 50 members of the Southeast Health Center's clinic. And we worked and trained them on how to prescribe nature and outdoor activities that are tailored to each individual patient. So the prescription, the park prescription, the activity, the park, the location may differ for say, an elderly patient with type 2 diabetes compared with, say, a young person with ADHD. The prescription may look very different. We also helped embed park prescriptions in the clinic's computer system so that the number and type of prescriptions were being logged and then the results measured. We developed prescription pads in 2 languages, and we plan to do that in more languages. Prescription pads that look like, medical prescription pads. I think they look better, actually, for outdoor activities. And again, all of that information was being logged. And we even persuaded the clinic to embrace time spent outdoors in nature as a 6th vital sign. So, as you probably know, a lot of clinics, they take your blood pressure and all these other things. So now, this pops up in the system when the doctors or the nurses are taking your vital signs, that they also log and ask you about time, the amount of time that you're spending outdoors in nature. This took a lot of work. This took thousands of hours of staff time in the community and in the clinic. After about a year's work, we launched it in April of 2013, and the results so far have been very encouraging. The clinic medical staff have really embraced this. They've logged hundreds upon hundreds of park prescriptions, and we're now working with the city of San Francisco to roll this out and to expand this to all 7 free public health clinics in San Francisco. And also some other counties close by are also taking an interest. Marin County are interested in this for their free health centers. So that's the local work. Regionally, we've been working for the past 2 years on a project called Healthy Parks, Healthy People Bay Area. And in this case, we've used a partnership model, a collaborative model, which some of you may have come across. It's called the collective impact model. It's an idea that came out of Stanford about 4 or 5 years ago. And it's really working well for us. It's helped us to bring together all of the park agencies across all 9 Bay Area counties. And we've connected, obviously, with our friends in the National Park Service, who are very active, fantastic partner in this. But we also brought in the city parks, the county parks, regional parks such as East Bay Regional Park, which is a major player in this, and more recently state parks as well. And we did something else. We also reached out, which was a much harder reach for us. We reached out to the health community. We reached out to private healthcare companies, to hospitals, to city and county health departments and their officials, to research facilities. And also there were several kind of individual doctor nature champions out there in the Bay Area who were kind of working away in isolation, championing this. So at this point, 2 years on, we have 40 organizations on board. We have high-impact programming across all 9 Bay Area counties, focused on providing healthy activities for high-risk and high-need individuals. And at this point, we've introduced our parks to several thousand new people who haven't visited parks before, who haven't embraced the park idea to this point. And that, I think that it's a really exciting program, and I feel like we're just getting started on this. So as we were doing this, so that's our local and regional work, and as we were doing this, we quickly realized that there were other early adopters of this idea springing up around the country. There were folks in DC, there were folks in Iowa, there were folks in New Mexico. All of us were trying something new, and often we were kind of toiling away in our silos. So in the second half, I forgot to say that, so these are the partners for the regional program. But in the second half of 2012, we set up a national park prescriptions initiative. We reached out to all of the folks that we knew of to build a coalition that's now grown to about 20 member organizations, and these are just some of the members. I haven't included them all, but these are just some of the members of the national coalition. And we've taken a co-leadership role with an NRPA, National Recreation and Parks Association, and with CDC, the US Centers for Disease Control and Prevention. And last October, after hosting a lot of conference calls and all this kind of stuff, we finally met up in person in Houston, October of last year, and really launched this thing properly. And we're now well on our way to identifying good practice, to developing a joint fundraising strategy, to also starting to work and think about common indicators and benchmarks so that we can send a stronger message and be more coordinated, and also help be more have more appeal to funders across the nation. And as a result of this, we've also been invited to join a global task force organized by IUCN, the World Conservation Union. So that's our health work. And now I'm going to talk a little bit about education, which we've heard some great presentations on education and communication in parks over the past couple of days. And at the Institute, we agree very, very strongly that education and interpretation is another area in which parks can and are playing a strong and important role. And in fact, national parks have a very rich history of providing this service. And we feel that this is a great platform to engage with new audiences. And we also feel that the challenge now is how to advance this mission of education and interpretation in a time of, firstly, fiscal austerity, which is challenging, and secondly, just rapid change. So our educational work is just 2 years old. We currently have 3 initiatives, and the first is focused on climate education. And we've heard a wonderful presentation this morning on climate science. And we feel that parks are really perfectly placed to speak with authority on this difficult issue for 2 reasons, and to empower the public on that, which I think is very important. The first reason is that parks are often on the front line of climate impacts. They're seeing that change, so they can speak about realities on the ground, things that have already been observed and that have already happened or are happening now. That's good, because it takes us away from science theory, which can be controversial in some areas. It takes us away from climate politics, which is also something that we may not want to get too caught up in. And the second reason why I think parks are the perfect venue for talking about climate change and communicating and having that conversation is that in an untrusting age where very few people, where the public trusts very few sources of information, park rangers show up in polls as being a very trusted authority. So far we've done 2 things. In May of last year, we published a report identifying examples of high-impact climate education around the world. We followed it up with a very successful conference in November of last year. And what we did there, which was great, we drew an audience from folks as far afield as Australia, and we brought in some real experts in terms of park education and the best practice there. But we also went a little bit further than that. We brought in experts doing really effective climate education in the museum system. We brought in experts from social and online media. It's nice, occasionally has advantages for being close to Silicon Valley. And we also brought in folks from the formal education system, from schools. We brought in authors who were talking about the art of storytelling, like Jonah Sachs. And we brought in researchers from universities to tell us about their studies and surveys on effective communication. And we're now looking at our follow-up on those two events. Our second project in the educational field is with the Chrissy Field Youth Education Center in San Francisco. So we have a local pilot program with them to help design and implement a prototype educational program for young people on health, wellness, and nutrition. It's kind of using the expertise we built up in that area, combined with just the wonderful educational programming that the Chrissy Field Center does. And for those of you who don't know the Chrissy Field Center, they've been around for about 12 years. They reach 26,000 young people each year, and their outreach is just phenomenal. And I think what's really remarkable and encouraging about what they're doing is that 80% of the young people they reach each year are young people of color. And I personally think that they're an example and a shining light of how we could be doing this across the system. So finally, at the national level, we're starting to collaborate with groups like NRPA and our friends at the National Park Service to look at how educational programming can be strengthened, and also to look at where the funding is going to come from, and at new and innovative sources of funding, which I think is critical to the success of this mission. So finally, last but not least, 4 years ago we launched our Food for the Parks program. So you probably all had experiences. I'm aware that Director Jarvis is in the room, so maybe I should be a little bit cautious about how I say this, but I'm sure that all of us have had experiences where occasionally in the past, the food that you've experienced in a national park is not commensurate with the rest of the experience. Yeah. So we were inspired by a few examples, a few shining lights around the country of where parks, park concessions, and individual superintendents were doing something better. They were serving, healthier food, or giving at least healthy food options. They were serving maybe more local food, more organic food, and they were just starting to tackle that issue. And so we did a couple of things. We published 2 reports. The first one was just just looking at those case studies and kind of really calling out and thanking those individual parks that were doing something special. The second was developing a roadmap for how any park could do better, irrespective of where its starting point is. And I know that some parks exist in food hubs and some are more in food deserts, but our starting point was that any park can do better on this, and can provide at least some healthy food options. And Director Jarvis really took a leadership role in this, and last June announced with Secretary of the Interior Sally Jewell national food standards for every national park site in the country, and that is going to affect that is already affecting 24 million meals served. So that's not only a fantastic thing in its own right, but it also brings the National Park Service into a wider conversation. Food and nutrition are becoming very, very big issues, very, very big issues with a lot of public interest and participation. The Park Service is now strongly placed to participate in that conversation as a leader in this field. And this is a photograph of some food that I actually bought recently in a park, shortly before I consumed it, and it was very tasty. Health, education, nutrition. These are just 3 areas where I believe the national parks can and are connecting with the public in new and creative and innovative ways. There are many others. These are just 3 examples. But my point here is that for parks to thrive in the next century, we need to be adapting. We need to be meeting people where they're at, meeting the need, and we need to be constantly looking for new ways to help and support all Americans. We also need to be reaching out and creating new partnerships for doing that, so that we can in the words of the California governor's advisor, we can collaborate to compete. Thank you. Yeah, and thank you. And I think we have about 5 minutes for questions, so.
So raise your
Great.
hand, we have microphones to come around to you if you have any questions.
I see one over here.
You mentioned the example of intervention, for medical disease states by visiting a park. So this is, what I would call reactive treatment. Do you think, that the nation's disconnect with nature is actually part of or causing some of the mental diseases we're seeing? And if so, would a more active preventive medicine approach be appropriate?
That's a great question. So the question was about whether this is a reactive response to our health crisis, and whether there could be a way to be kind of more preventive. And I actually and there has been a lot of great work done on nature deficit disorder. And if folks are interested, we published a report about that last year, which I have a copy of here and also is on our website. But I think I view it in two ways. I think in some ways, yes, it's reactive. I mean, we're seeing that there's this need. We're in the middle of a healthcare crisis and we need to respond. But I think the reason why we're getting a lot of interest in our work from groups like Kaiser Permanente and some of the other big health companies is that, in essence, it is a preventive healthcare strategy. If we can get people out into nature, into our parks, the research already demonstrates the dramatic impact that can be. Now, our project on the ground, our project in the community in San Francisco is really focused on people with high health needs. So in that respect, it's reactive. But I think ultimately, if we could get to a point where this is a strong preventive strategy, and I should say that that we're actually having a meeting with another meeting with Kaiser Permanente next week, where we're going to pitch this as something that we think they should be working on and rolling out across their entire network. So the long-term vision is that this could be a critical preventive healthcare strategy.
I'm just curious, in the national food standards that have been put out or rolling out, I guess, clearly an attention to nutrition, does that also include attention to sort of the sustainability in terms of food resources, food miles, all that kind of stuff?
It doesn't go into detail, off the top of my head, it does not go into detail about food miles, but it does talk about food sustainability and packaging and waste management, yes. Yes, that's correct. Yeah.
I agree with your work on climate in the parks and its potential, its opportunity, and the work that you're doing. Some issues have some urgency, and I'm curious on your thoughts of how you would take some of that work that you're involved in to scale, to broaden the scope of that kind of education and advocacy.
That's a very good question. How do we take these things to scale? We're working on things in a couple of different ways. I think, firstly, if we can test some ideas may need some more testing. So we're looking at the work that's been done so far on effective climate education, and we're trying to identify where the action points are, where there are moments where we can really start to empower people to act individually and collectively on climate change. And that's, we're still doing that research, we're still doing that work. My sense is that we may need to test some of those theories that we have out a little bit more. I think at the national level, we are very fortunate that we have a strong relationship with the National Park Service leadership, and so we're also working at a policy level on once we can identify those really powerful best practices, how do we also fund and support and roll those out? And so we're currently just starting a project with the National Park Service's Associate Director for Education, Interpretation and Volunteers, Julia Washburn, on that whole issue of funding and the whole business planning side of it, which sounds sometimes sounds less exciting, but is really critical to the importance of this. And I think ultimately funding is going to determine whether we succeed or not.
I think we have time for one more question. If there are any.
In the first 2 points on health and education, you actually mentioned sort of underserved communities. What about food? Is there anything you're doing in terms of people who are underserved in terms of nutrition?
Yeah, that's a great question. I think that the only project I would say that really addresses this at this point is our local pilot project that we're working on with the Chrissy Field Center. So we're leveraging the fact that they really do reach out to underserved youth and to young people of color, and we're introducing our kind of knowledge and expertise on the food and nutrition world. My hope is that is that we start to identify really powerful programming that can be replicated and scaled elsewhere.
Please join me.
Thank you.